Granting Hope, stories of Pelotonia-funded research at the Ohio State University Comprehensive Cancer Center, James Cancer Hospital, and Solov Research Institute. Each year in the United States, more than 100,000 women are diagnosed with cancers affecting their reproductive organs or lower gastrointestinal tract. Radiation is often used for treatment. While effective, it negatively impacts the pelvic health and sexual function of more than half the women who receive it. Now, with the support of a Pelotonia Idea Grant, a team of expert researchers at the James at Ohio State is working to learn more about treatment after effects. The team's research focuses on the human microbiome, the collection of microscopic organisms that live in and on the human body, in this case, the microbiome in the pelvic area of the women who receive radiation treatments. Dr. Daniel Spakowitz, a research team member, says scientists are just discovering the many ways in which these microbes affect a person's health.
We're learning that they have this really tight interaction with the immune system especially, which means they affect things like inflammation and whether or not you have various healing processes that go on.
Dr. Spakowitz says the vaginal microbiome could hold the key to improving treatment outcomes.
We're really excited about it in this context because not only can we use it to predict who might have certain patient-reported outcomes, but also that immediately implies this therapeutic target we can go after because we know that we can change somebody's microbiome.
Dr. Elizabeth Arthur, an advanced practice nurse at the James at Ohio State and the first nurse to receive a Pelotonia Idea Grant as a principal investigator, has spent years learning firsthand about these treatment outcomes.
So often we measure things with our patients, but it's really important for us to ask how these treatments really impact their quality of life, including any distress that we're causing them, and specifically with our project, in relation to their pelvic health and their sexual health.
The team's research involves collecting a large amount of patient and clinical data. Another member of the team, biostatistician Dr. Molly Moe, will play a key role in turning the data into meaningful results.
I work in biomedical informatics. My role for this project actually is involved in designing and planning for the whole study, and I will be helping with the management of the data. I also will do the data analysis together with the whole team.
The research team hopes that by better understanding the vaginal microbiome, their work will eventually lead to reducing post-treatment challenges and providing women with better quality of life outcomes. The members of the team also acknowledge that it's unlikely studies like theirs would be possible without Pelotonia and the people who support it.
I mean, it's such a gift that so many people are giving so much of their time and so much of their effort to supporting this research, which I think can really help people. But it's also really filling a gap because I feel like this type of thing, particularly in its early stages, is something that it's really difficult to find funding for. And so being able to bring these early stage studies to patients at the James is only possible with the help of Pelotonia.
Pelotonia and the James at Ohio State, granting hope to cancer patients and to the people working for a cancer-free world.